Hello students, welcome to learnclassic.education. Today we are going to read about vesicovaginal fistula. Now, what is vesicovaginal fistula, that is VVF, is an abnormal communication between the urinary bladder and the vagina. So, this is an abnormal communication between urinary bladder and the vagina. Then it causes continuous leakage of urine through the vagina. So, Vesicovaginal fistula causes continuous leakage of urine through the vagina. It significantly affects physical, physiological, and social well-being. And it is a preventable and treatable condition. So it is not a cause of it cannot be untreated, left untreated or like that. So it is a preventable and treatable condition if proper care is taken. Then coming to the anatomy, we all know so this is the urinary bladder, this is the urethra, then this is the uterus, which is in the anteversion or antiflexed position, and then comes the pelvic floor muscles. These all are pelvic floor muscles. Then vagina, this is the vaginal part, and it's all discussed. And then comes the this is the normal anatomical relationship between the bladder and the vagina. So this is the anatomy: urinary bladder, urethra, vagina, uterus, and the pelvic floor muscle. Now coming to the causes of VVF, that is prolonged obstructed labor, gynecological surgery, that is specially hysterectomy, that is removal of the uterus, then pelvic trauma, pelvic radiation therapy, then coming to the malignancy and congenital abnormalities. So these are the causes of VVF. Coming to the risk factors are lack of skilled obstetrics care, prolonged labor, then early marriage and pregnancy, previous pelvic surgery, pelvic infection, poor access to healthcare. So these all are risk factors. It is very important. Just remember it: lack of skilled obstetric care, prolonged labor, early marriage and pregnancy, previous pelvic surgery, pelvic infection, and then poor access to healthcare. Now coming to the clinical features. Clinical features include continuous leakage of urine through the vagina, urinary incontinence, then foul smelling vaginal discharge, vaginal irritation, recurrent urinary tract infection, skin excoriation around the genital area. These are the clinical features, means signs and symptoms. Now coming to the diagnosis, how you can diagnose the VVF, it is through detailed history. Means you have to take the detailed history of the patient. If any of these signs and symptoms are there, that means there is a chance of VVF. Then physical and the pelvic examination. You need to do PV examination and all the physical examination. Dye test you need to do. There is a methylene blue test. Then cystoscopy, ultrasound, CT urography or MRI. MRI and CT urography is done only if it is required. Otherwise, it is not done. Then coming to the surgical management, how to manage in surgical way. It is timing of the surgery is very important to prevent the VVF. Means at proper time it should be done. Then transvaginal repair, transabdominal repair, laparoscopic or robotic assisted repair. So nowadays there is various robotic assisted repair that is done. Post-operative catheterizations and follow-up care. Follow-up care is very important for VVF. Coming to the complications. Now recurrent urinary tract infection due to urine leakage and contamination. There is a recurrent urinary tract infection, skin irritation and excoriation from constant moisture and urine contact. Vaginal stenosis. What is vaginal stenosis? It means narrowing of the vagina due to scarring. That means vaginal stenosis. Then dyspareunia, that is the painful intercourse. Due to scarring or dryness, during intercourse, it may become painful for the female. Then urinary incontinence, persistence leakage affecting quality of life, and psychological distress include anxiety, depression, low self-esteem and social isolation. So it also have impact on the quality of life. That is, it affects the physical, emotional, and sexual well-being. Now, the preventive measures that you need to do is maintain good hydration, which is very important. Drink adequate water to keep urine dilute. Avoid holding the urine. Empty bladder regularly and do not delay urination. You need to avoid holding the urine. If you hold the urine for too long, then it can be a leading cause for VVF. Then good feminine hygiene, it is very important. Wipe front to back. Keep the genital area clean and dry. It is very important to maintain the good feminine hygiene. Then wear comfortable cotton underwear. So avoid tight fitting and synthetic clothes. It can cause skin irritation and that can lead to vaginal fistula. So it is very important to wear comfortable and cotton underwear. Treat infection early. Now seek medical care for UTI or other infections promptly. Then regular antenatal care, monitor and manage during pregnancy to reduce pressure on the bladder. Regular antenatal care is very important. Then pelvic floor exercises, that is Kegels. It is a very famous exercises to strengthen the pelvic muscles, that is strengthen pelvic muscles to support bladder control. And healthy lifestyle, it is always very important to maintain the healthy lifestyle, that is balanced diet, regular exercise and maintain healthy weight. So coming to the management, that is conservative management. For small fistula, conservative management is enough. That is, many small fistulas heal spontaneously with rest, hygiene and observation. Then continuous bladder drainage with Foley catheter, that is keeps the bladder empty and reduces pressure and promotes healing. So whenever जब भी आपका bladder empty रहता है तो आपका pressure decrease हो जाता है, so that promotes healing. Then antibiotics for infection, treat or prevent urinary tract infection. Nutritional support, as already it was discussed, nutritional support is very important. That is high protein, balanced diet with vitamins and minerals to promote tissue repair and healing. Then counseling and psychological support, that is emotional supports, helps reduce anxiety, depression and improves coping. Coming to the conclusion, that is vesicovaginal fistula can greatly affect a woman's physical, emotional and social well-being. So early diagnosis and proper management improve outcomes. A multidisciplinary approach is essential for effective treatment and rehabilitation. Prevention through skilled care and awareness is the key to reducing the incident. And with appropriate care and support, women can lead a healthy and fulfilling life. So that is all about vesicovaginal fistula of today's class. Thank you.